Hi, Stacey. Welcome to the show. Very excited to have you on today.
Thank you for having me.
So, today we're going to focus on the postpartum rehab gap and about really having women know about how we can feel really good after giving birth, including our pelvic floor, our pelvis, our spine, the whole body, and how we can function better and recover better after giving birth. So, I'd love for you to start off with talking about your experience working with women postpartum and why you're passionate about this topic.
Oh, absolutely. So I have been a physical therapist for more than 3 decades, which is a little bit scary. And then also a registered nurse with a master's degree in nursing for about 4 or 5 years now. So my passion came with working with people generally with pain, being a physical therapist over the years, started in sports medicine, kind of moving into orthopedics. Then I had my own clinic in Australia where I focused on fertility, and then also postpartum support as well too, from a more natural perspective. When I moved back to the States, I opened my own clinic again, and I do the orthopedic, pelvic health, sexual health with some focus on postpartum and then really all ages.
Got it. Fascinating. So, you had experience just doing fertility and postpartum recovery.
Absolutely.
Yeah.
Yeah, it was a great experience learning because, I was in my 40s, I think, when I started that. So I'd had my son, so I was familiar with postpartum difficulties, things like that. And this is pretty much true today. Although there's a little bit more focus on it, it's still not regularly recommended by, OB-GYNs or, urogynecologists or anyone postpartum for patients to go and seek out pelvic floor therapy. And I have a machine called SoftWave, which it helps to bring more blood to the area, modulates inflammation, significantly decreases pain. We did a dyspareunia study, which is basically painful intercourse, and utilized this on the patients. It was IRB supported. I was the principal investigator. We did a multi-site study. And what we saw is significant changes in the tissue integrity. So whether the pelvic floor is upregulated or whether it's been, gone through a bit of trauma postpartum. And then we've got our hormonal changes. Softwave also helps with recovery and episiotomy recovery, C-section scar recovery. It's crazy how well it works on those things. So I'm hoping one of my goals is to get the information to people out there about pelvic floor therapy and Softwave together, accelerating people's healing after giving birth.
Fascinating. I use the Wim machine. It's tech heart therapy with radio
Yes.
frequency. That's similar to Sofwave, correct?
No, Softwave is a shockwave technology, so electrohydraulic shockwave.
I see.
So it doesn't use the radio frequency. The wave can penetrate up to 4 to 6 inches deep, and then Softwave is a little bit different from all the other shockwave devices. It goes wide as well. It's not an internal treatment; it's all external because of the
Mhm.
depth of penetration and the
Oh,
biological effect
so you
that it
don't
has.
have to insert it to work on the
Correct.
pelvic floor.
Yeah, because most people are like, "You're gonna put that where?" When you have to, do internal work, so this is a nice adjunct to that, especially as the body's healing, postpartum for sure.
So, is it causing some involuntary muscle
No,
contractions?
no, that's the nice thing about it is it doesn't, it's not like e-stim. When I first heard of it, I had never heard of it, so I kind of tried to lump it into an ultrasound category or laser category or e-stim category, and it's really its own technology, its own physics. And what we see with Softwave specifically, with the other shockwave devices, they say that they create trauma. But with Softwave, we see from studies over in Germany that there's absolutely no trauma created, that the wave is just stimulating the tissue so that the brain responds and says, okay, something's going on there, so let's send our reinforcements in. Stem cells go to the area. What are they called? M1 macrophages are downregulated, upregulated M2 macrophages. So we're getting more of an anti-inflammatory effect, and we get more of a regeneration versus a degenerative effect. So it doesn't replace what I do for physical therapy. It just accelerates the
Yeah,
patient's ability to heal faster.
that makes sense. And it could be used on other parts of the body as well.
100%.
Yeah,
Absolutely.
well, that's very cool. It's like a wand that you're doing.
Yeah, it's an applicator that you put on the area. It kinda looks like a dome, and the nice thing about this too, Softwave is a little different from other ones, is that the dome is malleable, so it's not hard plastic. So when you put it on the genitals, it's much more comfortable
Mhm.
than having something that's hard plastic sitting on the outside of the genital, especially postpartum, It's, the
Right.
harder plastic, tools can be obviously very uncomfortable.
Okay. So, yeah, I was wondering if it was like in the lower abdomen, over the pubic bone, but you're actually doing it over the genitals and the back as well, or no?
Yeah, right over the perineum, typically for most people, and if they have an episiotomy, we're, doing it right over that as well too with the sterile technique. We can do it suprapubically if we need to, but also then low back if that's involved. After our assessment, we try to figure out what's going on in regards to what the patient's presenting, and how they're presenting basically dictates how we use it.
Right. And I think that is really important for new moms to know that there's like so many great modalities that use hands-on body work with chiropractic, physical therapy, massage, that all are very healing and beneficial. And then for some tougher cases, bringing in a technology like a soft wave can be really helpful. In my office, I use the WinBack on the C-section scars with really
Mhm.
great results. So, like, that's where this tech can be so helpful. But I agree, it doesn't
Yeah,
replace the hands-on work that we're doing because
right.
that's very healing as well.
Exactly, exactly.
Cool. So, I'm curious because you had a practice in Australia. Was there more referrals for pelvic PT versus the US, or was it
Well,
similar to like Europe?
it was back in the early 2000s, like to 2014 that I was there, and physio is a little different there. Most people it's direct access. You just go to the physio. You don't need a doctor's order, things like
Right.
that. So from that point of view, they're more open minded. From my point of view, I had to kind of do it on the sly because my licensure didn't equate over to Australia. So I did it more from a wellness perspective, but with my physio background. And then I also had a holistic part of the clinic and a wellness clinic where I was working with nutrition, supplementation, lifestyle as well too. So we kind of came at it from a, very holistic, natural point of view.
Yeah. And are you doing that still now back
Yeah,
in the
that's what I
States?
do, and then coming back to the States, I do it's interesting over in Australia, they were much more open to, like, herbal supplements and tinctures, things like that, so we utilize that more there. Here, where it's more geared towards any of the supplements. First, it's always nutrition first, right? You can't
Yeah.
supplements are just supplements, right? They shouldn't replace a good, healthy diet, but they do help with areas that we're lacking in, right? So omega-3 essential fatty acids is so huge, especially in postpartum and even during pregnancy as well too.
Yes.
So what we found with that is uh, here in my clinic now, we look at hormones, we look at their supplementation, make sure that's appropriate and personalized. You don't want to have buckets of supplements to take every day. We look at stress levels, right, and then we look at the biomechanics. We look at the physical body as well too, how they're moving, what the joint and muscles look like, and then really the whole package of putting that all together for a more holistic, personalized approach.
Hmm. And so are you so it really sounds almost like a functional medicine type approach.
Exactly. That's
Yeah.
exactly what it is.
Which I love. I do that as well. So, yeah, we're looking at the entire lifestyle because that's also gonna create pain. So what if you find like someone's pain is very, psychological, which, I mean, we do know there's a big component of that as well.
Mhm.
What are you doing to help address the emotional, mental component?
So we're definitely meeting the person where they are, right? So making sure that, what do they understand about that? Because there's a whole pain science, really, especially if this is chronic. So let's say, we're talking now about postpartum, but what if that postpartum pain doesn't go away, right?
Yeah.
So that becomes more chronic, or then the actual brain changes, the plasticity of the brain, it actually changes to be more upregulated, more hyper responsive to even small stimuli. So we talk about pain science a lot and what their body's doing. So trying to get them to consciously first understand, and then we can go through things like diaphragmatic breathing is probably the simplest one to just teach to down regulate that sympathetic nervous system and up regulate the parasympathetic nervous system. So we're down regulating the stress, fight or flight, and up regulating that rest and digest so that we can kind of get that nervous system down. Then you have a physical way of doing it. You feel like some of it is within your control. And then after that, we talk about different things like, what are you thinking about? Are you focusing on your pain all the time? Is there catastrophizing there? And if necessary, we refer out to a cognitive behavioral therapist to help them with that more in depth. But sometimes it's just enough to help them just realize that that's an aspect of their pain. And that by addressing it with meditation, mindfulness, whatever turns out to be the right thing for them, can help them manage their pain and potentially eliminate it as well too. And that's one component along with all the physical component as well too, and hormonal component.
Right. I mean, it's so true. I think bringing that to the consciousness is like the first step, and then once you're aware of it, you can really see, oh, am I focusing on that? Am I obsessed over that? Right.
Exactly.
And then how can I switch, what I'm thinking and feeling and
Exactly, and breath work, even as simple as diaphragmatic breathing, is such an easy, gateway, a bridge to really understanding how we can start to control our physiology just through breathing. And it sounds kind of woo-woo, but there's a massive amount of research behind it to show that. I mean, John Hopkins talks about it. The Cleveland Clinic talks about it as well too. I just don't think it's reinforced enough to the patient themselves.
Mm. Yeah, breathing's so powerful. Like you said, it's really impacting the vagus nerve function and that parasympathetic increase. And it's empowering because you don't need to buy anything. You don't need to go anywhere. You can do it from anywhere and you just need a few minutes. What
So
type of breath, like, is there a specific breath that you like to recommend to patients?
the first one we start with is, your diaphragmatic breathing, commonly called belly breathing. I was
Hmm.
just interviewing a physical therapist who's a pelvic health specialist as well, and she calls it umbrella breathing, which I like that term too because it's more that pictures that more of a 360 change. So not just, making sure that your hand is rising as you breathe in on your belly, right? And not bringing in the accessory muscles at the top and your shoulders and neck and things, but just thinking now, okay, so my hand is coming up from my belly as I'm breathing. That's great. I'm getting my diaphragm into it. But now let me think about my ribs and how they're expanding like a bucket handle, right? And now let me think about how it's expanding in my back as well, too. So kind of just thinking about the whole umbrella. So really we start there. And then there's some more advanced breathing, things that I've done with meditation that's helped patients as well, too. Dr. Joe Dispenza, I've done a couple of his meditation retreats and have pulled some breathing techniques from him as well. It's just some great ways to help alleviate pain. And it sounds weird again, but breath work really significantly can help with alleviating pain.
Stacey, I don't think it sounds weird at all. It makes
Good.
so
I'm
much
glad.
sense to me. And I've
Good.
been dying to go to a Dr. Joe Dispenza
Do
retreat.
it.
You loved it,
Mhm.
you went too. Wow.
Absolutely. I love
Yeah.
the fact that he is doing some research and that, and I was in one of the research studies with they took my genetics and they're monitoring it based on the change and just that week worth of meditation and then they do blood work and they have brain scans going on. It's phenomenal what they do.
Yeah, it really is. Because all of this, stuff is impacting the physiology of the body, and there we have a lot of ways to measure that, right, and show those changes, and it's powerful. What we can create. So that's the other thing I think you're speaking to. Like if somebody is stuck in that pain pattern, but they want to create health, they can focus on shifting their focus, right, and shifting and like really focusing on having a healthy body, a pain-free body,
Hmm.
almost like a mantra, right? Along with
Yeah.
all the other things that are going to support them in moving towards health.
Absolutely. And, since we're talking about postpartum, there's patients that I've seen who have had vaginismus, right? The fear of intercourse due to pain,
Mhm.
especially right afterwards, or if they're not healing because their hormones aren't coming in and balancing right away after birth, which it takes some time. They can develop vaginismus, which is debilitating, right? And they can't have sex because it's so painful, and then the whole series of cycle of the fear contributes to the pain, then the pain gets worse and worse. So, utilizing soft wave to help calm that tissue down is one way to do that. And then internal pelvic floor work can help. And then just helping them through the process with breathing, just, introducing intercourse, slowly again. And, it makes such a big difference when they understand that they do have control over it. It's not something has to control them.
Right. Yeah, there's that empowerment component. When you're checking for hormones, is that typically blood or urine? Like what do you how do you
So usually they start with blood with their physician, but what I'm honestly mostly interested in is how their body's utilizing those hormones. So we use the Dutch test or
yeah.
something similar to take a look at the metabolites, right? So I tell my patients if a house was made of Legos, each of those Legos are a metabolite. So we want to see how the hormones are breaking up into those little Lego pieces and being either excreted in the body or utilized again by the body. That tells me a bit more than, what the levels are on a blood test. But postpartum benefits of those blood tests right away are actually good because we're seeing how their body has gone from very high levels of estrogen and hopefully progesterone as well too, and then how are they coming down back to that normal? Do they come back out of balance? Do they come back in nice balance? So blood tests can be really beneficial as well too in postpartum. But I use the metabolites more if they're not getting better. If they, yeah, everything else looks supposedly looks good. We check their thyroid function, we check their adrenals, but then we also want to look at those urinary metabolites.
Yeah, and I like the Dutch test as well, and really kind of looking at the whole endocrine system is what you're speaking of.
Hmm.
So if somebody's been under chronic stress, then we can see also that might impact how their hormones would recover after giving birth, right? Because the
Exactly.
adrenals are exhausted, their cortisol levels are imbalanced.
Exactly. And what a lot of people don't understand is high cortisol is an issue, but low cortisol is an issue too. Because when it's too high, it's pro-inflammatory, but when it's too low, we don't get any of the anti-inflammatory effects from it. So in essence, it can when it's in its Goldilocks range, how I like to call it, in the range that it should be, and how it is higher in the morning and then drops off so that we can go to sleep at night. If that's all nice and balanced, then actually an anti-inflammatory hormone. But we want to look at, for the Dutch, we want to look at what are the cortisol levels doing throughout the day. Do we need to boost the system to help cortisol actually come in so we'd have a little bit more of that anti-inflammatory effect, or do we need to bring it down? Because the symptoms related to those two different levels are very similar. So you can have fatigue or feel really stressed or whatever. And chances are, if you're a little younger, if you've had kids, you're probably in the high cortisol. But then potentially, if you're a little older, then there is a good chance that you could also be low cortisol instead of high. So I like it for that reason too. It kind of distinguishes between those.
And I've had a patient with PCOS that had low cortisol. Have you seen that as well?
Oh, absolutely. Yeah, I mean, PCOS, depending on how bad it has been and how inflamed their system is, how inflammatory it is, because as we know, there's an underlying insulin resistance to that usually. So that when that accompanies it, that's long-term significant stress on the system. So at some point, they probably had high levels of cortisol, and then eventually, because the length of time our body was under that physiological stress, those cortisol levels came down for sure.
Do you use a lot of ashwagandha with these types of patients?
I do as an adapted. I use adaptogens like ashwagandha, and ashwagandha specifically if I know that their thyroid, maybe it's not a medically needs to be medically treated, but maybe a little bit subclinical
Mhm.
and just a little bit off of where we'd like it to be. Ashwagandha has those dual effects on thyroid T4 levels, and then also on helping the adrenals as well too. I use rhodiola or Rehmannia. Um, Gosh, there's so many adaptogens that you can use that I love.
Maca.
Yes, exactly. Yeah. So there's a lot of good herbs to utilize, but also I don't want patients to forget about nutrition, right? So we need
Yeah.
to look at their nutrition, and also, as I talked about omega 3s before, or anti-inflammatory, a good probiotic to give you a good support of your microbiome, and then a good multi, in my opinion, to kind of hit the gaps.
Right. So it's interesting. A lot of pain can have an underlying inflammatory component to it, right? So I think a lot of people underestimate the power of good nutrition and how important their diet is in going either direction, right? Either anti-inflammatory or pro-inflammatory. So what kind of nutritional recommendations would you make to somebody to help with the anti-inflammation?
So the first thing that has the best amount of research, or I should say a decent amount of research, is the Mediterranean diet, right? So number one, you're getting rid of the ultra processed foods. You're looking towards eating more whole foods. You're balancing your proteins with your good carbs and your good fats. So that's going to be somebody who's basic. Now, somebody who comes in and who's already doing that, we
Yeah.
start to question why aren't they getting the results that they want, even though they are the majority of the time eating this way and not having too much alcohol or any of those other inflammatory things. That then I look at food sensitivities. So then it could be that, and I use the ALCAT. I don't use IgG testing because that's been proven to be not very accurate or overall in the long term when we look at it. The ALCAT test is nice because it takes from the blood, the white blood, white blood cells from the blood, exposes them to different food. So we have a representation of our immune system and how it reacts to food. And then, so then let's say in the Mediterranean diet, they're eating a lot of hummus, but they're moderately reacting to chickpeas. Hummus probably isn't a really good thing in the Mediterranean diet for them, right? That's
Right.
adding to the inflammatory process. So we find the foods that they are not reacting to or only minimally reacting to, eliminate the few foods that they are moderately or severely reacting to, and then we work on rebuilding their gut, right? So we want to make sure that their gut is healthy, good, healthy microbiome, good mucus production in the gut to actually feed the microbiome so it doesn't, take doesn't tear apart its own, tight junctions and cause leaky gut. And then, yeah, and then we from there we just work with the patient for the best eating plan for them.
Okay, got it. Yeah, and I think a lot of it is even just it's getting off of the ultra processed foods and then having more whole foods, which, can require a little more work, right? It's meal planning, meal prep for people that are busy working, but it's really valuable, right? When we see the health benefits that come from avoiding chemicals in our food.
Yeah, I mean, we have to look at it as, how medicine looks at the benefit risk ratio for medications. We really need to start looking at our foods like that, right? So if we keep eating foods that are going to be inflammatory because it's inconvenient for us, what are the risks to that? What's the benefit risk ratio? Then we have to decide, okay, well, I'm going to be okay to hurt or to have pain or
Mm,
whatever symptom it's causing, right?
consequence, yeah.
Yeah, so we've gotta balance that, I think, a little bit better, and, instead of, I mean, I'm busy, I know you're busy, and I, don't, have Whole Foods every single morsel that I put in my mouth, but I'm very particular about the foods that I do choose, and even the ones that are more processed, I'm still reading labels, and does that take me a little longer in the grocery store? 100%. But I'm reading labels so that I don't have something that will make me feel terrible for a week or 2 after I ingest it, or won't make me feel bad the next day as I ingest it. So yeah, it's an insurance policy and it's time that we have to invest into ourselves in order to help us feel better. And I don't know about you, but when I had my son and postpartum wise, I was more concerned about his nutrition, and not mine. But because I was more concerned about his nutrition, I started paying more attention to mine. This was almost 30 years ago now, before I kind of was focused on it. And that's when I started to feel better. I had some health issues after having him, and when I changed my eating plan, when I got my gut back on track, because I was helping him with being as healthy as possible, that just it was a light bulb that went on and said, "Wow, I mean, if I wanna feel this way all the time, it's about what I'm putting into my system to feel that way," right?
Yeah, exactly, and then we get to model that for our children as well, so it's like,
Exactly.
this is how we eat. It's not like you have your crappy processed kids food, right? And then this is the adult food. It's like, no, kids can eat what their parents are eating, and, we can teach them that this is, eating real food is anybody can eat it. You don't have to be an adult to eat real food.
Exactly, and postpartum is really important from a standpoint if the person is breastfeeding. We
Yeah,
say breast is best, right? And it is, but the breast milk also encompasses the nutrients and things that we're eating. So if you really want breast milk to be best, you need to give yourself the nutrition because you're transferring that over to your baby, right? So thinking about, it's not about putting yourself first, but at least right alongside your baby and the importance of feeding yourself healthily and well. And it's hard, postpartum is hard. It's lack of sleep. It's hormones are going crazy. It's not the easiest time to meal prep or plan.
right.
So hopefully you have some sort of support that you can lean on. If you don't, at least making the effort to be as consistent as you can or to minimize those processed foods as much as possible so that you're giving your baby even, if the bestest, I don't know what's better than best, like the best breast milk that you possibly can
Yeah,
if
for
you're
sure.
able to breastfeed.
And it would even, impact the amount of breast milk, like, in other words, if you're eating healthier, your body would be able to ideally, have more milk as well,
That's
and
smart,
that
yeah,
hydration as well. So, like, that the support is so important those first few months, after giving birth, where recognizing you can't do it all. You're not gonna cook and clean and do laundry and breastfeed and care for your baby,
Mhm.
and feed yourself healthy foods, right? Like that is not really possible. And we don't see that anywhere in the world. Women after giving birth are resting and they're feeding their baby, and then everything else is taken care of, including nourishing healthy foods. Like bone broth is a wonderful food to have postpartum to help with milk production and the recovery of the body. And so having that prepared, right, and stews and soups and these warm, nourishing foods that are going to accelerate the healing process and also support your milk supply.
Exactly, 100%.
Yeah. Well, Stacey, did you have any last thoughts that you wanted to share with the audience?
From a postpartum perspective, I would just say, even if you don't have any significant issues, I would still say ask your OBGYN to write up an order to meet with a physical therapist, a pelvic floor physical therapist after birth, just to make sure that you could prevent having problems potentially in the future. And a pelvic floor physical therapist is not just somebody who teaches you how to do Kegels exercises. Someone who's really understands the pelvic floor will also help you with movement of your whole body, right? Because your ligaments and everything are kind of coming back online from the standpoint of your estrogen changing and the other hormones that are changing after birth. So it's important to get somebody that's experienced with dealing with somebody with postpartum so they understand the whole picture, and doesn't just give you a worksheet that says, here, do these Kegels exercises, because pelvic floor therapy is much more than that. So sometimes it takes a little time to find that right person, and sometimes you have to pay out of pocket for that person
Oh,
too if
yeah.
they're not within your insurance system.
Yeah, for sure. I have a pelvic PT in my office. We work very frequently together because
Good.
I find that the chiropractic adjustments, the alignment are so supportive for the recovery. And then the strengthening is also really important. And that's where pelvic PT can be so helpful. So the two together are fantastic. And I wanted to also have you share about your book that
Oh, great.
came out last April.
Thank you so much. So the book is called The Pain-Free Formula: Solving the Puzzle of Muscle and Joint Pain Without Surgery, Drugs, or Injections. So the first part of it talks about how conventional medicine deals with pain and where some of the issues are with that. And for example, if you take NSAIDs for long periods of time, you actually increase your risk of developing chronic pain, right? So you're
Yeah.
actually creating more situations where you can actually feel higher levels of pain than you would normally. So we talk about conventional approach. And then the second half is about looking at everything that we've just talked about today, looking at how you're moving, looking at your food, looking at any sensitivities, looking at your hormones, looking at stress, looking at how you're managing stress in your system, and being able to recover. So it's not specific to postpartum, but anything will apply to that time of life because it's all the things that if we do it now, you're going to have better after, you're going to be better after birth, then you're going to be better as your kids are younger, then you're going to be feeling even better through perimenopause. So instead of getting to menopause and perimenopause and being like, oh, this is the worst time in my life, it helps you prepare for those situations so that they're not the worst time and that you can actually plug into some of the wonderful things about getting to those ages.
Yeah, and it is prevention is best, right? So I think it is one of the really recognizing that when we do this and have this lifestyle and it's for the rest of our life, we are going to go through life cycles with more grace and less symptoms. Symptoms are not normal, right? They're their body's way of telling us something is wrong. And,
Hmm.
I think there has been very much a normalization of perimenopause and menopause symptoms. And I think it's important to recognize that we do need to talk about it and the conversation is important, but we don't need to also just normalize it either,
Right.
right? Like it's like, okay, let's come up with a root cause solution,
Right.
which may or may not be hormones.
Yeah. And those symptoms, like you said, are not normal. They're common, but that doesn't mean that they're normal. Right.
Right. Right. So recognizing that and also recognizing we don't have to suffer in silence. Like it is important to get help. And if you feel dismissed by your practitioner, then you just have to, find someone else that's going to be open to listen to you and support you and getting you where you want to go.
Laura, I couldn't have said it better myself. That is
Right.
awesome.
It's like beating myself on the head when they're like, well, this is what my doctor said. I'm like, you know what? I that's not okay. I'm not okay with what they just said because that is really dismissing where you're at and also just making people feel very much in that victim role, right? Which is not okay.
What just makes my skin crawl, I get so irritated at this, is when they say, "Well, my doctor says it's not that." So whatever, I might say that it could be thyroid or it could be this. My doctor says it's not that. And I'll say, "So then what does your doctor think it is?"
Right. They don't know.
So they don't know. So, but they're so quick to not all
Dismiss.
doctors. I have
Yeah.
some very good people who refer to me and who I refer out to, but they're so dismissive without looking into it just because of the dogma of conventional medicine versus going, you know what, maybe let's dig into that a little bit
Yeah, let's be
and let's
open.
work as a team, right? Let's work together instead of pushing people's opinions away.
Right. 100%. Well, Stacey, thank you so much for coming on the show today. I really enjoyed it.
Oh, it was fantastic. Thank you for having me.
Well, I hope you enjoyed today's show. Make sure to check out Stacey's new book, The Pain Free Formula, Solving the Puzzle of Muscle and Joint Pain Without Surgery, Drugs, or Injections. In addition, if you need extra support and guidance with your own personal health journey, I'm here to help. I'm now offering virtual functional medicine consultations, specializing in preconception, fertility, and women's health. Please go to my website at drlaurabrayton.com. That's DRLauraBrayton.com. Click Become a Patient to schedule a complimentary 15-minute discovery call with me to see if my program is a good fit for you. Also, if you love this show, please leave us a review. It helps us reach out to more women in the global community who are looking for this type of content and information. Simply go to ratethispodcast.com/well-adjusted mama and follow the simple instructions.